Okay, today we're diving into something truly terrifying. The Black Death. We're talking 1347 to 1351. This wasn't just a disease, it reshaped, well, everything in Europe.
It really did. The scale is hard to grasp. In just 4 years, maybe a third of the entire continent's population wiped out. That's over 25 million people.
And
Gone.
the fear, it must have been overwhelming. You'd see people, your neighbors, even family, developing these awful swellings, buboes, then fever, and often death within days.
And with no science to explain it, people defaulted to what they knew. Maybe God was angry. Or maybe it was just the air itself, this idea of bad air or miasma.
Right, because the smell of death would have been everywhere.
Exactly, you couldn't escape it.
And our sources are pretty clear this wasn't originally a European problem, it came from outside.
Yeah, the consensus points towards Central Asia. It seems to have traveled along the Silk Road, the trade routes.
And then hitched a ride into Europe.
Pretty much. On trading ships hitting Mediterranean ports, carried by fleas living on rats carrying the bacterium Yersinia pestis.
Such a tiny biological thing causing such utter devastation. And that lack of understanding is key, isn't it? It explains why their responses were often so off the mark.
Completely. And that's really our focus today, isn't it? We're looking beyond just the horror. We want to explore the strategies, the beliefs, and frankly, the sheer luck that lets some people survive.
So this deep dive is kind of a shortcut for you, the listener, to grasp how people coped during maybe the biggest crisis in human history. What worked, what didn't.
Precisely. Based on what they did, what they wrote, what they experienced.
Okay, so let's start with the most obvious response, especially if you had money, distance, running away.
Flight. It's the oldest trick in the book. When facing danger you can't fight. And in places like Florence or London around 1348, if you were wealthy, that was your best bet. Just leave.
Yeah, wealth literally bought you breathing room, didn't it? I'm thinking of Boccaccio, the Italian
Yeah,
writer.
to Cameron, exactly.
Yeah.
He described these wealthy Florentines just packing up and heading to their villas in the countryside, getting away from the crowded city.
They understood on some level that being close to others, to the sick, was dangerous.
They certainly learned it quickly. Proximity equaled risk. But it does highlight that stark inequality, doesn't it? The rich could isolate. The poor were often stuck.
Right. Trapped in the crowded, unsanitary conditions where the plague just ripped through.
But there's a twist there, a sort of grim lottery. Sometimes being poor and isolated actually saved you.
How so?
Well, think about peasants in really remote villages, far from the main roads, the rivers, the trade routes where the rats and merchants traveled. Their isolation, their poverty, actually shielded them.
So being disconnected was a lifesaver. The core lesson, learn the hard way. Distance was protection.
Absolutely. But, not everyone could run or would run.
Yeah.
Eventually, communities had to try something more organized.
Because the plague didn't just vanish, people realized fleeing wasn't a long-term solution if society itself was collapsing around them.
And this is where we see the beginnings, really, of public health measures, often brutal, driven by sheer necessity.
You're talking about organized responses.
Yes, forced innovation, you could say. Look at Venice, a huge trading hub, right? They figured out pretty quickly that ships were bringing the sickness.
So what did they do? Stop the ships.
Not stop them entirely, but control them. They made ships arriving from known infected areas wait offshore for a set period before anyone or anything could come ashore.
Ah, and that's where quarantine comes from.
Exactly. The waiting period was 40 days, quaranta in Venetian. That word stuck.
40 days? Why 40? Was there a medical reason or?
Not really medical, more cultural and religious. 40 days is a significant number in Christianity, right? Lent, Moses on the mountain, the flood.
Okay, so it felt like a proper period of purification or testing.
Sort of, yeah. Whether it was the perfect incubation period for Yersinia pestis is debatable, but it definitely created a buffer. It slowed things down, which was critical.
Slowing it down was probably the best they could hope for. Venice used waiting, but other places, they were more drastic.
Oh, much more. Which leads to some really tough ethical questions about how far authorities should go in a crisis like this.
Like Milan, I read they were quite successful, but used extreme methods.
Extremely extreme. If someone in a house got sick, the officials might literally brick up the doors and windows, seal the entire family inside, sick and healthy together.
Wow, that's horrific.
It is. But from a cold, pragmatic view of community survival, it worked. It stopped the disease spreading from that house. Milan fared better than many other Italian cities, partly because of these ruthless measures.
Horrifying efficiency, as you said. Okay, so beyond these big state-level actions, What were ordinary people doing? Still stuck on the bad air idea.
Very much so. The miasma theory dominated. If the air itself was corrupt, you had to purify it, right?
So what did that involve?
People were trying anything, washing floors and walls with vinegar, burning strong-smelling incense or herbs like rosemary, lavender, carrying little bundles of herbs, called posies, to sniff.
Trying to create like a personal bubble of good air.
Essentially, yes. They were totally wrong about how the disease spread. It wasn't the smell, but some of those actions weren't entirely useless.
Oh, how so?
Well, cleaning surfaces, even with something mild like vinegar and just generally clearing out filth, it might have reduced the rat and flea populations slightly, improved basic sanitation. It was an accidental benefit. Early science, almost, stumbled upon by mistake.
Interesting. Okay, let's shift from the physical to the psychological. Faith must have played a massive role. If you believe this is God's punishment.
When survival becomes about appeasing God, doesn't it? Intense prayer, repentance, acts of piety, that becomes your shield, your spiritual strategy.
But didn't that create a terrible paradox? The things people did for faith often put them in more danger.
That's the heartbreaking irony. Yes, acts of devotion often became super spreader events in modern terms.
Like what? Going to church.
Exactly. Gathering in large crowds for mass, for prayer meetings, and then you had movements like the flagellants.
Ah, the groups who whipped themselves publicly.
Yes, hugely popular for a time. They'd travel town to town, whipping themselves, believing this extreme penance would persuade God to lift the plague.
I can see the appeal, in a way. A desperate act for desperate times.
Psychologically, it fulfilled a need, but epidemiologically, a catastrophe. These were large groups, moving constantly, attracting huge crowds.
Spreading the plague like wildfire.
Pretty much. They were like a mobile disease vector, linking infected and uninfected communities perfectly. Devotion inadvertently fueling the disaster.
Yet you also had people within the church, monks and nuns, who did stay and care for the sick, didn't they? Despite the risk.
Absolutely. Their vows often compelled them to stay. And yes, the death rates among them were astronomical, but those who did survive, they learned things.
Learned by doing.
By necessity. They observed symptoms closely. They figured out basic ways to ease suffering, manage fevers. It was rudimentary nursing born from crisis. Early palliative care, you might say. It laid some groundwork, however small, for future medical practice.
Okay, now let's get to the really weird stuff. The folk remedies, the cures doctors were trying. It sounds like desperation mixed with total confusion.
Well, it was the Wild West of medicine.
Yeah.
Physicians were basically guessing, throwing anything at the wall to see what stuck. The list of attempted cures is quite something.
Give us some examples.
Well, you had dietary things, like eating tons of garlic or onions. Then mineral cures people would literally crush emeralds and drink the powder.
Crushed emeralds. Seriously.
Seriously. Believing the purity or value of the gem would somehow cleanse them. Then there were more invasive things, like bloodletting with leeches, and perhaps the most infamous.
Don't tell me it's the urine thing.
It's the urine thing. Bathing in it, sometimes even drinking it. Peak desperation, as you said earlier.
Unbelievable. And obviously none of this worked against the actual bacteria.
Not a chance.
Huh.
But the desperation did lead to one very iconic image. The plague doctor outfit.
Ah, the mask. The big bird beak.
That's the one. We all
Okay.
picture it. It looks terrifying now, but it had a purpose based on their understanding.
Which was the bad air, the miasma.
Exactly. That long beak wasn't just for show. It was stuffed, absolutely packed with aromatic herbs. Mint, camphor, cloves, rosemary, lavender.
Like a personal air filter?
Kind of, yeah. A portable miasma shield. They thought if they breathed in good air, filtered through these herbs, they'd be safe. The smell was key.
Did it offer any real protection?
Well, the herbs did nothing against Yersinia pestis. But the rest of the outfit, the heavy leather gown, the gloves, the mask itself, it did provide a physical barrier, probably reduced flea bites. So, ironically, it offered a slight accidental advantage.
So, a little bit of protection by accident, but mostly survival came down to, what, luck? Your immune system?
Pretty much. A strong constitution, maybe some prior exposure that offered slight immunity, and yeah, a huge dose of sheer random luck. But then after the worst waves passed around 1351, the survivors found themselves in a completely different world.
Right. Let's talk about the aftermath. The consequences for society. It wasn't just fewer people. Things fundamentally changed.
Fundamentally, this is where the plague becomes a revolutionary force. It acted like a brutal but effective social leveler. That massive death toll wasn't just a tragedy, it was an economic earthquake.
How did it shake things up economically?
Think about labor. Suddenly, there weren't nearly enough people left to work the fields, run the shops, do the crafts.
A massive labor shortage.
Exactly. And if you were a peasant who survived, suddenly your labor was incredibly valuable. Your bargaining power just shot through the roof.
So they could demand more.
Absolutely. Higher wages, better conditions. Many serfs found they could simply leave the land they'd been tied to for generations because landowners were desperate for workers. Plus, survivors often inherited land or money simply because everyone else in their family line was gone.
Wow. So wealth got redistributed and power shifted towards the workers.
It absolutely did. The old feudal system, already under strain, really started to crumble. Landowners, the nobility, the crown, they panicked.
Is that when they tried to impose wage controls? Like in England?
Precisely. The Statute of Labourers in 1351, a direct attempt by the English Parliament to force wages back down to pre-plague levels, to stop peasants moving around for better pay.
How'd that work out?
It failed. Utterly. You can't legislate against basic supply and demand when the supply of labor has been decimated. The economic reality just steamrolled the law. Power had shifted irrevocably towards the common worker. It fueled social mobility, peasant revolts later on. It really helped dismantle serfdom over the long run.
So the catastrophe, ironically, paved the way for some long-term improvements.
In a brutal, roundabout way, yes, it forced change. Medically, while the initial responses were weak, the sheer scale of the crisis forced people to think about organized responses, quarantine, sanitation, which laid groundwork for future public health, culturally, religiously, economically. Europe was never the same.
So if we try to boil it all down, the core lesson from surviving the Black Death seems to be about adaptability, resilience.
I think so. Human adaptability. The ability to react, whether it was running away, enforcing brutal quarantines, demanding better wages, and resilience, definitely. Enduring the unimaginable.
And it's striking how relevant some of this still feels, isn't it? 7 centuries later.
Incredibly relevant. Think about our own recent experiences with pandemics. Isolation, quarantine, the desperate search for treatments, the economic impact. The echoes are right there. We're still grappling with the same fundamental challenges.
We're still learning those lessons about community, adaptation, science, and resilience.
We are. The cycle continues.
Which leaves us with a final thought for you, our listener. Looking back at the Black Death reminds us that even in the absolute darkest times, survival often belongs to those who adapt, who find ways to organize and endure, and crucially, who never completely give up hope for a changed world on the other side.